The Training and Education Collaborative System, TECS-PERLC, is one of 14 preparedness and emergency response learning centers funded by the CDC. TECS-PERLC is a collaborative of all 3 schools of public health in Texas. The School of Rural Public Health at Texas A&M in College Station serves as the grantee. The school has expertise both in providing training for the broader public health workforce and facilitating community engagement, with a particular interest in working with rural and underserved populations. The University of North Texas Health Science Center School of Public Health is located in Fort Worth, Texas. Their expertise focuses on public health laws such as isolation and quarantine, and training topics that are relevant to local emergency preparedness efforts such as SNS pod management of volunteers. The University of Texas School of Public Health is located in Houston. Their Center for Emergency Research provides trainings focused on improving public health capacity to address disasters more effectively, especially through public health and medical collaborations. They also mentor a strong student EIS program that routinely assists in surveillance activities. Our center currently has partnerships with both Texas and South Dakota. Although dispersed geographically, both have a large rural component and have reached out to us to help with some of their unique rural challenges. Texas is the second largest U.S. state in population and in landmass. It is also a state of many contrasts. On one end of the spectrum, Texas has 6 of the 20 most populous cities in the U.S., but there are also very rural sections of the state. Half of the 254 counties do not have a local health department, and 131 are designated as frontier. Texas responds to a large number and type of disasters each year. Much of the state was under extraordinary drought conditions in 2011, which led to a series of devastating wildfires. By the end of September 2011, almost 4 million acres in Texas burned. Texas is also known for hurricanes and recurring issues with flooding and tornadoes. In addition, Texas had the dubious honor of being the first state to identify cases of H1N1 in this country. Our center has a long-standing working relationship with the Texas Department of State Health Services. We provide face-to-face and online trainings to a broad audience that includes the public health workforce, school nurses, community health workers or promotores, elected officials, and traditional first responders. South Dakota is also a very rural state. More than half of their 66 counties are designated as frontier. The public health system is centralized, with only one local health department in Sioux Falls. During the past several years, we have developed close working relationships with both the State Health Department and the Office of Emergency Management to assess, develop, and deliver training to the public health workforce, key community stakeholders, and emergency management. In 2011, the Missouri River flooded, with many communities in South Dakota being affected. In addition, the state is inundated with tornadoes and blizzards annually. And during the past several years, South Dakota has had human outbreaks of the norovirus and measles, as well as plague and black-footed ferrets. Our center works closely with state agencies to facilitate community engagement in clusters of rural communities across the state, as well as to deliver face-to-face trainings to health department personnel on topics ranging from agri-terrorism to rapid needs assessment. Our center has also been working hard to develop a relationship with the Sioux tribal populations in South Dakota Indian Country. There are 9 tribal governments located in the state. Each tribe is recognized as sovereign. The South Dakota Department of Health has asked us to assist them in preparing tribal members to be better prepared to respond to disasters that affect their communities. With assistance from the Aberdeen Indian Health Service, we identified a universal, mischievous tribal character named Iktomi that was being used by IHS to reach children about important health topics. Adapting this character, our center created materials on infection prevention and family preparedness, which are currently being used in IHS health clinics in South Dakota, as well as by community health representatives working with tribal populations across the U.S. We are very excited about the relationship that we are building with the Cheyenne River Sioux tribe. This tribe has a population of approximately 8,100 and is located in central South Dakota. We were asked to help the tribe exercise their emergency preparedness plan in the spring of 2012. We are also working very hard to develop a relationship with the Oglala Sioux tribe southeast of Rapid City. This reservation is considerably larger than Cheyenne River and is one of the poorest areas in the U.S. There are many challenges here just to function day to day, but there is increased awareness for the need to be able to respond to disasters more effectively. We are working to bring key tribal leaders together for a facilitated discussion and training. Both of these tribes have serious challenges they routinely face. The fact that these people survive today is a testament to their own resilience. But aside from the many socioeconomic and health issues they face, the Cheyenne River and Oglala Sioux need to prepare for increased dangers from tornadoes and blizzards. Overall, TECS-PERLC works closely with our state and tribal partners to ensure that we understand their individual strengths and challenges and that we're responsive to them. Our goal is to enhance the public health workforce and improve capacity for community resilience by providing planning, training, and exercising at the state, local, and/or tribal level.